Dr. Roger Sdao here with Freeport Family Chiropractic and Acupuncture. Thanks for joining us here today. We're going to hopefully start doing these on a little more of a regular and consistent basis with our YouTube channel. And we're going to try to use this as a resource for you guys, as some health tidbits, some services that we offer here at the office, some things that we take care of that you might not have otherwise known, and just basically chiropractic in general. So today I want to talk about discs. We hear a lot about bulging discs and herniated discs and ruptured discs, and what does that all mean? So before we start with that and kind of get in the meat and potatoes of that, I wanted to go through some anatomy here. So here we have a spinal segment here where you have your two vertebrae, and then you have the disc in between, and that disc basically separates the two vertebrae, and it basically acts like a shock absorber for those bones, so that way they don't rub together. You'll notice, think of a disc like a jelly-filled donut. So if you're looking at it like this, the jelly is in the middle, what we call the nucleus, and then you have this kind of tougher outer cartilage here, kind of like the rings of a tree, if you can see that. And that basically contains this inner nucleus, which is really high in water content. It's got a lot of oxygen and nutrients for the disc in case there's some sort of injury to the disc. But when we start talking about a bulging disc, what happens here is that this outer wall, which is still contained, this material starts to kind of push its way off to the sides here, usually. And when it does, it basically just bulges, as easy as that term is. So as long as that outer material, or excuse me, the outer wall here is maintained, that's basically a bulging disc. So think of like a water balloon. When you squeeze a water balloon, as long as it doesn't break and it just kind of bulges, that's what it is, because the material still, the balloon is still contained. The next thing we start to talk about is a herniated disc. So that's where all of a sudden now we're dealing with the wall here that starts to kind of tear, if you can kind of see that. So it can kind of tear around, or it can have these horizontal tears across the material here. And then what starts to happen is this nucleus starts to kind of push its way through. Just like that, if you can kind of see that. That is what we call a herniated disc. As that material now pushes its way through the tear, now we got a different situation here. It's a little more serious. And then if that continues, and then all of a sudden this outer layer starts to totally tear away, now the material on the inside starts to kind of push its way through that. Now we have a ruptured disc, where when you're looking at it from the side, you'll see as it's bulging, but as it ruptures through, it's kind of going to irritate that nerve even more, causing more inflammation, causing extreme pain, possibly some radiation, whether it's going down your arm or down your leg. Those are the two more common areas that we see. But that's the difference. So in essence, when we talk about a bulging disc, a herniated disc, a ruptured disc, we're in essence talking about the same thing, but what part of the problem are you at during that phase? So that's basically what we wanted to talk to you guys about today. Lastly, though, to let you know, like I said, it does take a while, and it can take a while for these things to heal for people who are have struggled with them in the past or are currently struggling with them now, because there's a very poor blood supply. So that's the reason why it does take a long time. But that's something that we do deal with here in the office, and we see it quite regularly. So if there's anyone that you know that think could benefit from that, by all means, share this video with them. If you like this video, please like it. If you really like it, subscribe to our YouTube channel, and hopefully we'll see you on the next time. With all that, take care. Bye-bye.